Okay, welcome everyone. If there are any questions during the event, please reach out in chat. This is Justin Stone Diaz, and we'd like to thank you again for tuning in. And with that, I'll turn it over to you, Tenzin.
Tashdele, thank you, Justin. Good evening. Tashdele, in Tibetan, Tashdele is auspicious well-being. I'm joined here tonight with Dr. Nyima Tsering live from Kathmandu in Nepal, which is at 6:30 in the morning. Here in London it's 1 o'clock, and we're really excited to present this presentation tonight on Tibetan wellness and mental well-being. Thank you, Justin, for the introduction. If I can. So tonight we have about an hour and a half, and we propose to spend about 45 minutes to an hour introducing you to ourselves, first of all. Secondly, the introduction to Tibetan medicine. We'll speak about our history of Tibetan medicine, how Tibetan medicine is practiced today, the future of Tibetan medicine, what makes Tibetan medicine unique, and especially its focus on mental wellness and what it can actually offer for a lot of the mental health conditions and issues that are present in today's modern society. Then we'll go on to a study of specifically rLung energy, where Tibetan medicine categorizes humans according to 3 different energies, rLung, Tripa, and Becken. And it's a very complicated study because that's also dependent on lots of different factors. And Dr. Nyima will explain more on that. We'll also have 2 case studies, one on a lighter form of mental issues, with some information about the patient, about how Dr. Nyima diagnosed the individual and how Dr. Nyima treated the individual and any improvements he was able to see in the condition of the patient. And the second case study is a more severe mental health issue, and Dr. Nyima will explain more about the diagnosis treatment plan. And finally, by zooming in, you have the opportunity to ask Dr. Nyima any burning questions on Tibetan medicine, on mental wellness, or anything you'd like to know about his background and his expertise. It's a really great opportunity, and we're really grateful to have somebody like Dr. Nyima, so generous with his expertise and just so committed in his purpose of promoting Tibetan medicine through this webinar. Dr. Nyima, I'd love for you to introduce yourself. Thank you.
Okay. Hello, everyone. First of all, thank you so much for having me here and giving me this opportunity to speak about the Tibetan medicine. My name is Nyima Tsering. I'm a Tibetan medical practitioner based in Kathmandu. I've studied on Tibetan medicine from Menla, from India. So Menla is considered to be one of the primary kind of institute for studying the Tibetan medicine. It is kind of a Harvard to Tibetan medicine actually. So where it has a long history of institution. So which was established in 1916 by 13th Dalai Lama, and then later re-established by the 14th Dalai Lama in 1961. So then after finishing my studies at Menla, and also I studied the Buddhist philosophy from Institute of Buddhist Dialectic School from Dharamsala from India. Then after finishing my studies, I worked at Menla for 1 year, and then after that I then here in Kathmandu we started the because with so many reasons, so we started the college here on kind of a proper academic program where we have established a college called Sowa Rigpa International College. So that was like affiliated to Lumbini Buddhist University. And at the same time, I was also practicing at my clinic at here in Kathmandu, that is called as a Kunpen Tibetan Medical Center, which is one of the first clinic in the Kathmandu Valley. So at this moment, I was working as a chief physician at Kunpen Tibetan Medical Center, as well as working at the college as a principal of the college. So thank you so much for having me here.
Thank you. Dr. Nyima, we lost you for a few seconds. I think it might be due to the internet connection. So if anyone sees us breaking up on the webinar, please bear with us. It's due to technical issues, zooming in from halfway around the world. If we miss anything, I'll be sure to point out, and I'll reiterate some of the main points in some of the slides going forward. Thank you, Dr. Nyima. And about myself, I am a Tibetan woman. I was born in India. I'm born and raised in India, but I've studied internationally in Europe and the US. I actually find myself almost exactly half my life in the East and half my life in the West. And I had an idea for an app that connects people to Tibetan medicine doctors and dispatches the Tibetan medical supplements just from a real life need to connect my mother-in-law to Tibetan medicine doctor and the difficulty in finding one. And I thought to myself, surely somebody can put her on an app, and there must be so many people who don't know about Tibetan medicine outside the Himalayan region, but who are interested in it and could really benefit from Tibetan medicine. So I created this app. I have a day job completely different from Tibetan medicine. I am a lawyer by training and I work in banking. And I think what I bring is that objectivity and fresh eyes in Tibetan medicine. And I really want to mainstream Tibetan medicine. And the purpose of doing this webinar is to promote Tibetan medicine and plant a seed about Tibetan medicine and healing in anyone who's interested in it. If this sparks interest in learning more about Tibetan medicine, speaking or consulting with a Tibetan medicine doctor, qualifying maybe even as a Tibetan medicine doctor, that would be great. We want to help all Tibetan medicine practitioners, whether they're on the app or not. I think Tibetan medicine is so big and vast and bigger than all of us. And it's such an ancient form of healing that really deserves to be promoted outside the Himalayan region and for people who actually really would benefit from it the most. And I'm trying to do this within the context of a Tibetan employed and Tibetan empowered team, because I think that promotes a service and a product that's very authentic. And it's my goal in life that His Holiness, the Dalai Lama, sees this initiative and sees what we've done and, feels proud of what we've achieved as, global Tibetans trying to bring Tibetan medicine to the world. So without further ado, I also, as I said before, with my legal training, I do have to note that this talk is just to explain and share aspects of Tibetan medicine, but the techniques and the supplements here that we may prescribe should not be considered a replacement for any treatment plan or diagnosis or for any psychological or mental conditions. We understand, mental conditions, mental wellness, it's on a huge spectrum from, very light forms of mental issues such as, a passing blue to actually very severe medical conditions, which really deserve, proper and personalized diagnosis and treatment plans. So please use this presentation and this webinar for educational purposes. If you can take away some knowledge about Tibetan medicine, some self-care, some ideas about a balanced lifestyle, about self-care tips, that's great. Take what you can out of it. And we also hope that you can, light another candle and promote Tibetan medicine or, simple lifestyle tips and advice to somebody else who may not watch this webinar, so that, Dr. Nyima's expertise and his knowledge can actually be spread around the world. I feel really lucky being born in this lifetime, firstly as a Tibetan, as an empowered Tibetan, and also being able to leverage technology that, we're in different time zones, but we can all zoom in and share such unique healing traditions and try to help others. So please use this and take as much as you can out of it. If you have any further questions, please reach out to us, and I'll put our contact details at the very end. So we currently have a global mental health crisis. We already know about 10% of the world's population is affected by mental health issues at any one point. About 20% actually of children and adolescents suffer from mental health disorder. Here in the UK, mental health issues are actually, the second largest disease burden. And so, mental health issues are actually a leading cause of ill health and leads to less productivity in workforce as well. There are lots of socioeconomic factors that affect mental health conditions. We know the most vulnerable in society, women, LGBT, those of lower socioeconomic backgrounds, they're actually disproportionately affected by mental health issues. And they also lack access and knowledge. And, it's so sad because those are the individuals that, need mental health help because they're so vulnerable in society. On top of that, we've all endured the last 2 years, this pandemic. Different parts of the world continue to have severe lockdowns, which actually exacerbate some of these mental health issues amongst the vulnerable and disadvantaged in our society. As working professionals and working members of society, there's also this feeling of burnout, this constant state of feeling exhausted, mentally, physically, spiritually, emotionally. That's why we have some of the modern phenomena like the Great Resignation. People, just not accepting this huge burnout in their lives and wanting to lead better lives. There's a move towards, alternative, integrative, complementary medicine, and looking inwards when we can't go out, looking inwards and actually thinking of how can you take care of ourselves better, our communities better. So it's been a very interesting time where everyone's been affected. I think everyone's struggling no matter where in society they are. Sadly, some parts of our society, some demographics are hit harder. And global mental health issues, continue to become more critical. Why now? We've just gotten out of January. Sometimes January does feel like the longest month ever. It feels like Christmas was so long ago. People are exhausted. They're feeling down that they haven't achieved 101 of their New Year resolutions. There's no presents, no festivities. Everyone's doing dry January. So I know at this time, with the weather conditions, dark days, very little light, cold days, a lot of people are already suffering these blue moods, this winter blues, and seasonal affective disorder is really rampant at this time. So this is why we're doing this webinar on mental health issues at this time, in the context of already a global mental health crisis, the pandemic and lockdown and all this pressure that's bubbling, and seasonally, and the climate is people are more prone to feeling down and blue. So hopefully we can explain some of our concepts and give you some tips on well-being, and plant some seeds to help you with your general self-care going forward. It's important here to just highlight mental health issues as both a symptom and a condition. I was speaking the other day to a medical doctor who said she works in some of the deprived parts of London, and she said there's so many mental health issues, that she couldn't even determine where it became from a symptom to a condition, and overlapping issues that made, even the medical conditions worse. I've also heard from medical practitioners saying that, when on the other hand, patients who have a very positive outlook and a healthy mindset, they seem to recover faster. It seems to also aid in the recovery. So it's very, very interesting. And, Dr. Nyima, if you wanted to add anything that you've noticed in your practice on mental health issues as symptom and condition, please jump in.
Yeah, as Metok said, so this is actually it's a very important topic, and also as a human being. So from the Tibetan medicine perspective, we take that this is part and parcel of our life, So even from the modern medicine, they says that to have a stress is kind of normal, like so at any given situation when there is a difficulty, it is a human, like biologically, it's a human tendency that it secretes the cortisol hormone. And then because of that, we got the stress. So from the modern medical perspective, and at the same time, when we become happy, or if anything that, like goes good with our life, then, the oxytocin hormones were secreted. And because of that, it says that this is considered as the problem in terms of the mental, the phenomena. So similarly, in Tibetan medicine, we say that, so since this is very much connected with the teaching of the Buddha, so where it says that, everything's were connected, not only the physical level, so we so-called the psychosomatic, kind of relation. But in Tibetan medicine, along with that, we also talk about the energy kind of, so it revolves around the body as the physical body. Then we have mind. Then there's energy, energy level. So these three has to be balanced. So it's kind of we are conditioned that to bound to have these kind of different problems. So so more we will discuss in the following conversation.
Thank you, especially for highlighting the psychosomatic link. I think that's really keen and crucial here. What is Tibetan medicine and healing? It's called Sowa Rigpa in Tibetan medicine, in Tibetan actually, and it's a very ancient form of healing, 2,500 years, with roots from India, from Chinese medicine, from Greek medicine, and also just the Aboriginal traditional Tibetan plant medicine. And actually, in almost every society, there's already been plant medicine and herbal remedies in almost every society that we have. And now we're seeing this disillusionment with conventional medicine and people moving towards, going back to the roots and seeking more natural solutions. So there's been a renewed interest and I hope growing interest in Tibetan medicine and healing, and people only just now realizing there's this ancient form of healing. It's practiced in the Himalayan regions of Tibet, Nepal, India, Bhutan, Russia, China, Mongolia. And actually half the world already recognizes and practices Tibetan medicine. A lot of the Tibetan medicine doctors on my app have received the Indian government's gold medal in alternative medicine. And there's a huge acknowledgement of Tibetan medicine and how the Indian government values it and spotlights Tibetan medicine. And it's very relatively unknown here in Europe and North America, but we are looking at traditional Chinese medicine and Ayurveda as precedents, and how these have gained in popularity in complementary and alternative medicine in the last 10 years. I think if there's more knowledge about Tibetan medicine, especially for people who are already interested and possibly using Indian Ayurveda and traditional Chinese medicine, I think then there's a real alignment, lots of similarities and differences. Similarities in those healing sciences. Of course, there's some differences because Tibetan medicine is quite unique. Similar to traditional Chinese medicine, consultations with a Tibetan medicine doctor includes, the pulse analysis. It can also include urine analysis, observing the tongue and taking the patient's history and speaking more about the condition. A lot of my patients in the app say speaking to Tibetan medicine doctors actually sometimes like speaking to a therapist and just working out issues, and they feel lighter afterwards. On the app, you don't have the pulse analysis because the technology hasn't been integrated yet, but we have everything else like urine analysis, observing tongue, and mainly speaking to the patient, especially with chronic conditions like insomnia. It's diagnosis over video consultation is absolutely fine. The important thing is speaking to a Tibetan medicine doctor and giving a full history about your condition, but also doing a lifestyle review, what you're eating, what your habits are, what your sleeping habits are, etc., which really give the Tibetan medicine doctor a holistic idea of your lifestyle and more about your condition, and they can then calibrate a treatment plan. And they use a very holistic way of treating the patient. They use herbal, so that could include, supplement recommendations or physical exercises like a certain type of yoga. They use nutritional and dietary, just taking certain foods at certain times of the year, maybe even giving a recipe, behavioral, psychological, spiritual intervention, and external therapies like massage, acupuncture, moxibustion, and cupping to treat conditions. We'll talk more about it in the 2 case studies later on in this presentation. Dr. Nyima actually explained what he recommended and why. In the past, Tibetan medicine, 2,500 years old, managed to find a picture of Chakpuri Tibetan Medical College. That's one of the other premier Tibetan medical schools in Tibet. The exiled Tibetan population, 14th Dalai Lama of Tibet, re-established Menzikang, which is the Tibetan Medical and Astroscience Institute in India in 1961. That's a picture, the one in color, of Dharamsala, of Menzikang in Dharamsala, which is the largest kind of hub and their flagship college and offices. But they also have about 50 plus branches all over India. And we have also, medical Tibetan medicine clinics in India and Nepal, like Dr. Nyimala's Kunpen. And the future, we see the future as an app where anyone with a smartphone can connect to Tibetan medicine doctors, get information on Tibetan medicine, buy some of the medical products with the app. You don't have to, find somebody who knows somebody who knows somebody who knows a Tibetan medicine doctor. You actually just can see vetted English-speaking Tibetan medicine doctors and book an appointment and consultation that's convenient for both the doctor and yourself. And really, I see this as the future. I think it's global, it's scalable, and we're presenting this. My intention is that when people use the app, they say, "What an amazing app!" And it happens to be run by Tibetans. Tibetan medicine always has a focus on mental wellness. It sees and acknowledges this mind-body perspective, the psychosomatic conditions that Dr. Nyima spoke earlier. And we've got this long history and rich culture of Buddhism and the study of the mind and mental conditions that, really complement what Tibetan medicine already studies about mental conditions. Among Eastern medical traditions, Tibetan medicine is actually considered one of the most advanced and comprehensive in terms of classification, diagnosis, and treatment of mental conditions. Tibetan medicine doctors also, provide a very holistic treatment plan, and they sequentially match the treatment with the severity of the condition. And they'll work with the entire community. They won't just see the symptom in isolation. I think that's the distrust and the disillusionment with conventional medicine is, it's attacking the symptoms, and then you take medicines and chemicals that create other symptoms, but at least you've, put a Band-Aid on that one condition. People actually want to go to the root cause of the condition and really actually heal it. From my personal experience, I'm a mother of 3 children. My son had eczema And I did lots of research, as any parent of with a child with a medical condition would do. And I found that his eczema correlated with his allergies. And the more research I did, I tried to improve his gut bacteria, because what I noticed here in the UK is all the doctors, they would just keep prescribing hydrocortisol and increasing dosages of hydrocortisol. But really what I wanted to do is a whole lifestyle review and actually get to his actual condition and what I could do to treat him for the long term, so he doesn't have this dependency on the hydrocortisol every time he has an eczema flare up. And I did, and I spoke to a Tibetan medicine doctor. That was one of the first ways I was introduced to traditional Tibetan medicine. And she did a lifestyle review and said, avoid ketchup, avoid citrus fruit. I later went the conventional medicine route and went to see a pediatric dermatologist here in Harley Street. And the pediatric dermatologist said, you should avoid these high acid foods. And, it was so amazing that, all this ancient knowledge and conventional medicine actually aligned. My child really benefited when we cut out this food. I gave him a lot of probiotics, a lot of yogurt. And he had his eczema from when he was 2 months old. And by the time he was 2 years old, he'd lost all his allergies, and even the peanut allergy, which is actually very severe here in the West. Only about 20% of children really grow out of the peanut allergy, but amazingly he was able to be healed. I have my third child who has eczema. It's a burden of being in the modern world and having all this processed food, that we have all these modern conditions like eczema, and I'm working on her eczema and treating it the same way that I treated my son's eczema and allergies, using Tibetan medicine, using holistic natural treatment. Especially for young children, you don't want to go the harsh chemicals, but you want to look at natural ways of alleviating the condition, and also going to the root cause and making their condition and their life better. So I think that's a lot of people's journey to Tibetan medicine as well, and I wanted to share my personal experience and my journey, why I use Tibetan medicine and why I believe in Tibetan medicine. And this is why we're up at 1 o'clock in the morning and 6:30 o'clock in the morning to do a presentation, because we really truly believe in it. And I'll pass it over to Dr. Nyima.
Okay, yeah, so as Menla said, Tibetan medicine is considered to be a very holistic medical system. And also it has a written record of more than 2,500 years. So as Menla put it in a very beautiful way. So of course, there are a lot of narrations on the origin of Tibetan medicine, and also this become a very heated topic at this present scenario, where some scholars says that it came from Tibet, some says that no, it came from India, and some says that and also when you look at this, all these different places where Tibetan medicine is practiced, so one can see that it was practiced. Of course, it was practiced in Tibet and all these Himalayan belt, in India, also in Bhutan, also in Mongolia, also as well as in North America. But when we look at the names of the Tibetan medicine, so basically, as Menla put it, so this was now the common name is the Sowa Rigpa, that was basically used by almost all the practitioner. But also you can find different names in different locations. Suppose like in Himalayan regions, in one point of the time, this is called as Amchi system of medicine, or for example, in Bhutan, this is called as a Buddhist medicine. And when you go to Mongolia, this is called as a Mongolian medicine. But this is actually the medical practice is kind of the same thing. So that's why so I think this is a very good kind of this is the beauty of the Sowa Rigpa medicine or Tibetan medicine, because in each different zones, it is working with own kind of it suited their own climate. So that's why everybody claims that this is, it belongs to me. So that is the, that is the reason why this is effective, or it has some value, especially within the, Tibetan kind of, field of studies. So normally we say that there are 10 different fields of studies. So the first one is the Buddhist philosophy, then the Tibetan medicine, then we have the, the linguistics, then we have the, like Tibetan astrology, and then the arts, like this, we have a 10 field of study. So among them, Tibetan medicine is one of them. So in a sense that as far as the Tibetan medicines, as a field of studies, this is always connected with all these different other, the field of studies, especially with the Buddhist philosophy. So, so that's why when we look at, especially when we were explaining the Tibetan medicine, so this is always connected with the teachings of the, the Buddha. So that's why even when we talk about the root cause of any disease, this always come back to the teachings of the teachings of the Buddha. And also, His Holiness Dalai Lama often, put this in a very beautiful way. He, His Holiness used to say that, Tibetans have a very rich knowledge of this Buddhist philosophy, a very profound knowledge of philosophy, which is very, useful for the, especially for the compassionate, base, system. Like for example, the Buddhist, this culture, or the Buddhist philosophy, or all these different types, practices of Buddhist, practices. So this is mainly focused for the mind, kind of, to have the peace of mind. Then we have this Tibetan medicine, which is very good for the chronic ailment. Many of the chronic ailments, like, the chronic arthritis, and chronic, diabetes, and even, some of the chronic cases of cancer. So, so many like for example, we have in India, we have a, a well-known physician called Dr. Ishi Tenzin, so who have been treating a lot of cancer patients. On for that ground, the Indian government also, so likewise, it is, so these were all connected. And often I have seen that, the Robert Thurman, he put this in a very beautiful way, where he said that, when we look at the modern kind of the, world, so the more focus is put in the material kind of the world, where, like people have been doing a lot of studies and putting a lot of efforts to find the, the external world, especially, making all these different rockets to go to the moons and other planets. But on the other hand, other part of the world, like in Tibet, so for centuries, these peoples were, mainly focusing on internal kind of the, the mechanisms. So that's why, like for throughout the centuries, so there have been, so many different, like meditators and so many, scholars. So they were putting heart and souls, for finding out how does these, different types of mind and mental factors and these different types of emotion works, So based on that, so today, so Tibet itself is known to the rest of the world as a kind of a, like primary, masters who have some knowledge in the internal world. So I think this is very important. So with that, to talk about the Tibetan medicine on the disease of the mind. So normally we look from a very holistic perspective. So like even when we talk about the so we really classify all these differences, like so as far as the mind is concerned. So this is like not only the Tibetan medicine, even like in the Buddhist philosophy, this is the kind of the main focus of the the field. So so when we look at the Buddhist philosophy, we have so many different types of philosophies as well as different systems. Like basically there are like a sutra and the tantra, So in sutra teachings, it's basically talking about the transformations, or basically talking about the, so then there is a tantra teachings. So in as far as the sutra is concerned, so the classifications of mind is such that, especially in the teachings of Vasubandhu, so where it classified the mind in so many different classifications, where it says that there's a mind and mental factors. Then mind was also classified into 7 different types of mind. Then, then 2 different types of mind. So there are so many different types of classifications. Then as far when it reached to the Tantrayana or Vajrayana Buddhism, so then it, instead of talking about the, the renunciation, it talks about the transformation of the mind, like taking the problem as it is, and then, trying to change. So that's why it always says that Tibetan medicine is always connected with the teachings of the Buddhist philosophies. Then from the Tibetan medical perspective, so when we classify the disease, so any kind of disease, so normally, there are, in terms of the classifications, there is endless number of different types of disease, but we put all these disease into 4 different categories. So where we say that, 104 different types of disease. So as you see on the slide, so there are like, this is classified in 4 different categories. So like there is 101 disease, so-called as a miscellaneous disease, like a normal kind of common cold, where we don't need any medicine support to, to fix that problem. So, so there are so many diseases that needs no medicine or any kind of, remedy measures. So which basically, fixed with our own immune systems. So these are the disease, like the miscellaneous disease. Then we talk about the conventional disease, like this is actually this classification is those diseases that actually, trying to, like treat with the today's conventional medicine. So like, for example, problem of the gastritis, problem of the diabetes. So all these different problems are put in the category of conventional disease. So these are the disease that needs the medicine to, to fix the problem. Then the third category is considered as a psychological disease, or even sometimes we call that as a problem due to the evil spirits or negative force. So since Tibetan medicine is so much connected with the Buddhist philosophy as well as the Tibetan astral science, so where there is a concept of a different realms and like a negative force. So because of that, then we have a lot of problems. So in this particular category, it basically talks about the importance of psychological kind of the like the influence, and because of that we have a lot of problems. So sometimes we used to have certain problems, and when we even though we like physically, if somebody have a lot of problem, then when you go to the hospital, they says that you are fine, in terms of the the examinations of ultrasound or any kind of these scannings. It says that everything is fine, even in terms of your like the function of your body, everything is in that range. So then it says that the cause of the problem is unknown. So sometimes this could, because of these psychological problems or something that is to do with the negative force. So for that, Tibetan medicine has so much things to do, like not only with the medicine, even from the astrological perspective, we have so many different types of provocation, so many different types of rituals, So some there, and especially in this, like topic, there are so many of the anthropologists have done research on this, especially with the the Charles Rumble. So he's a professor in Scotland. So he have done so much studies especially in the Himalayan regions. So he have traveled to especially in Nepal and India and everywhere, and he have done a lot of research. So one time during one of the conference, I have able to witness some of the research. So it was very fascinating. Especially this is also connected. So especially provocation is also connected with the Tibetans, the native kind of religion. that is considered as the burning religion. So from there were so many, propagations, different types of propagations. So this is also a very important, especially the today's, the topic. This is so much connected. And then the last one, 101 disease is called as a karmic disease. So again, in Tibetan medicine, we have the idea. We have continuation of so in Tibetan medicine, this life is kind of its journey. So we'll have a next life again, so this journey will continue. So in that process, so whatever we did has some impact, or there is a consequences, so because of that, the karmic kind of relationship. So because of that, so in some cases what happens is that so this is very much visible even in the societies. So some individual who were born as a genetic disease, or so-called as genetic disease, or there were so many problems. Even some some individuals who really have who is very good, but they have so many problems. So this also be considered as karmic disease. So this is, I think this is also very useful looking from. So sometimes people, they have to question that, why me, So this can also solve the karmic disease. And through, especially from the lens of the Buddhist philosophy or Tibetan medicine, we take that as, we accept any problem, at any given situation. So this is basically, these are the 3 different types of classifications. And with this, we basically, goes into the problems. Yes,
Yeah.
Metok.
Thank you, Dr. Nyima. Actually, wanted to highlight 2 things from your explanation of the 4 categories of diseases. One was finally about the acceptance of the diseases. Actually, a lot of patients come to Tibetan medicine doctors saying they want to understand the condition. There might be a disease or condition they have which has no cure, for example, dementia. But what they want to do is they want to just understand the condition, and they want to know how to manage it. And in that way, Tibetan medicine can help in managing your condition where there is no cure or where it's chronic, and really help you with that. Secondly, you made a really good point about the Buddhist base with Tibetan medicine, the interlinkages, how Tibetan medicine leverages off Buddhist thought and advances that they've made. Basically all the Geshe-las hold PhDs on Buddhist thought, and that is really a study of the mind, and at such a high level that Tibetan medicine can benefit from all those lessons, and then provide it in practical form and help patients. And it's very interesting. A lot of the Tibetan medicine doctors, they're so committed to the craft that they actually go on retreats. Dr. Nidala himself, Dr. Nida Chenatsang, who's also written this fantastic book on Tibetan Book of Health and Healing. He's just come off this year from a 6-month-long retreat. So they're also doing a lot of the practice themselves, and really understanding themselves, their body, so that they can help other patients more. So wanted to highlight that. I don't know if we were cut off with technology earlier, that the Tibetan medical course to be a Tibetan medicine doctor is actually a 5-year course, very intense course, everything from learning about how to identify the medicine, to making it, to treating and diagnosing patients, and then 1-year clinical experience. So they get the whole range of human conditions in different parts of India. So, by the time you're a qualified Tibetan medicine doctor, you've already had about 6 years of experience on the human mind and the human condition. So I wanted to really convey that to all the participants and those who are watching this, that the Tibetan medical training is very intense and very comprehensive, very dedicated, and that those who go into the practice are very motivated to help all sentient beings, and to help. And it comes from also, on top of that, the culture of compassion and of helping others, and using your craft to in a way good for your karma, and you're doing some good to others. So Tibetan medicine has these three energies as the foundation of diagnosing a patient.
You know, like
Nyima, we couldn't hear you for
okay,
a few seconds. If you could start again.
Okay. So this is called as this is called as the three energies, you know. So as I said in the beginning, so we always in the Tibetan medicine we talked about this physical problem, then the mental problems, then we have the energetic levels, you know. So according to the Tibetan medicine, you know, whether we whether somebody is a healthy state or unhealthy, this is basically determined with these three aspects of like life. So we have this physical, physical level of like the problem, then in a more like a mental level of problem, then in energetic level of problems. So and also energy and in energy level, this is more important in the in Tibetan medicine. So that's why, and this is also very common in most of the ancient Eastern tradition of like medicine, like not only in Tibetan medicine, even other systems of medicine also talked about these three energies basically. So in Tibetan medicine we say that rLung, Tipa, and Pagan. Then when we look at the Ayurvedic medicine, so they talked about the Vata, Pitta, and Kapha. So basically it's kind of the same thing. So on the other hand, when you look at the Chinese medicine, they talk about the yin and yang, that is cold and hot. Then they talk about the chi energy. So this is all, so this concept of energy kind of, like thing, it was very much there in most of the ancient Eastern system of medicine. So especially in Tibetan medicine, we talked about the three basic energies. So this also comes from, so there is a big conclusion in Tibetan medicine where we said that these very, our body, it basically, formed with the four elements, then when there was when there was imbalance in these four elements, then there is so-called the disease was, arised. Then to fix that problem, to fix any kind of problem, we need to balance these three, these four elements. Then, then also the medicines that we have to use has to come from the four elements. So it always revolves with these four elements, So similarly, this rLung, Tipa, and Pagan, this is nothing but it actually the elements. Like for example, when we say rLung, Tipa and Pagan, rLung is basically the wind element, So wind element is basically, it is a, like not only the wind that we experience. So there again, there are certain level of wind, like the grosser level element. Then when we say Tipa, this is talking about the fire element. Then when we say Pagan, this is talking about earth and the water element. So in a sense that the so-called rLung, Tipa, and Pagan is talking about the four elements. Like for example, when we say, when you talk a little bit about rLung, for example, so rLung is basically, it is that kind of energy in the body which controls the respiration, So we have to breathe every time. So this is basically done because of the rLung energies. So basically, these three different types of energies are basically the mechanism of our body. So that is the beauty of the ancient Eastern tradition of medicine, where we where we say that we are in the constant state of movement. So that's why we say that so this is the main difference with the biomedicine. So in Tibetan medicine we say that we are in every split second. So also this was concluded by Buddha saying that everything is transitory in nature in terms of any phenomena. So for example, the first one is the wind element or the rLung. So this, as far as the function of the wind energy, so it basically helps in controlling the respiration, Also, we swallow. When we ingest something, we need to swallow. So this swallow is also done by the wind element. Then the articulations. That it also manifests in physical, verbal, and the mental movement is also to do with the wind element or rLung energy. Then also as far as the exertions and also the sensory organ, the perceptual acuity is also done by the rLung energy. So moreover, the rLung, or the wind energy, it affects the metabolic separations of the nutrient as well as the waste product. And also the digestion, also the digestive waste elimination is also done by the rLung. So there are different classification of rLung, so which we will discuss in the following slide. Also, rLung also encompasses, many other functions related to the movement and also the signal response in the body. So the bodily, constituents, organs, and sensory organs. So these are all related with these rLung pathways, so including the bone, the heart, the colon, and also the hearing, and then tactile, sensory organs, and also the pathways supporting the life. So we talk about, so we also talk, emphasize about the, the life force, the so-called as life energy, or, so this all supports with the mechanism of the first one, the rLung. So then the second one is called as a Tiba. So this is more in terms of the elements, it is kind of the fire elements, So Tiba is actually related to the heat producing function of the body. So what, so we have the different heats in the body. So this is all because of this Tiba, energy. And it is also responsible for, thermal regulations, of our body, and also the metabolic, the power, and also heat in the digestion. So whatever we ingest needs to be digested. So many portion of this work is done by the Tiba, because of the Tiba. Then Tiba also regulates the cardiovascular functions. So this is also done by Tiba. And also the heart, as well as the blood constituent and different activities are all also done by the Tiba. Additionally, heat production affects hunger and thirst, Then the liver the skin and the skin maintenance, this is also done by the Tiba. So this is basically is the function of the body, in terms of energy. Finally, the Tiba involves the sharpness of the cognitive intelligence process. So in a sense that these three different types of Nyapas, rLung, Tiba, Pagan, so directly or indirectly, it has, influence to the psychological levels also. So that's why these all are interconnected actually. So even though we are, as a separate kind of entity, but in the real life, these are all involved together. So like in terms of the proportion. So finally, Tiba involves the sharpness of the cognitive as well as the intellectual processing. So especially its pathways, related to the Tiba is more related to the blood and liver and gallbladder and small intestine, and then the visual sensory organs, and then the perspiration. So this is how we deals with the the problems also. So with these, with correspond to the particular different personality or different energies. Then the last one is the Pagan energy. So Pagan is related to the solidity and cohesion in the body. So this is basically done by the Pagan. So namely, like providing support for the body as well as the mind. So promoting physical and mental patience, for example, tolerance and imputability. This is also done by the Pagan because of the earth and water element. So this can also be understood with the mechanism of each element. So when we say rLung, rLung is more kind of like light in quality. When we say Tiba is fire, so it's more kind of a burning sensation. Then in terms of Pagan, since it is because of the heaviness, earth and water elements, then even in the functions, it talks about tolerance, and then facilitating, it also facilitates the sleep. So the many of the sleeping problems is also, facilitated by the Pagan. Then also Pagan, it is producing the connectivity in the joints. So many of the joints problem is also connected with the Pagan energy. Then also the smoothing and oiling functions of all our organs, Also, it constituents and fluid in the body. So basically, all these fluid and constituent are always to do with the Pagan. So it's and the fluid in the body, and also like especially the muscles, fats, then the bone marrow, and degenerative fluids, and feces and urines. These are all connected with the mechanism of the Pagan energy. It also includes the olfactory and gustatory, like sensory organs, and also the lungs, spleen, stomach, kidney, urinary bladder. These are all many of these functions are because of the Pagan energies. So finally, it involves many of other fluids and oil in the body. So this is basically 3 different types of. So this is basically the bottom up of the Tibetan medicine. So based on that, we talk about the. Based on that, we talk about the imbalance or dysfunction of these 3 different. Then even in a normal state, this also determines the personality of every individual. So each individual is unique in its own place, So some people might be more in Lung type, some may be in Tibetan type, some may be in more Pagan type. So based on the the above functions, then we can also determine the personality of the individuals. So likewise, so even for the profession, sometimes we choose the wrong profession. So this also if we really know our own personality, then if you choose the profession, that is it will be very entertaining. Suppose a person who is especially like the like a policemen and like lawyers, they should be more Tibetan type, because they have to be in. They need that fire kind of personality. So person who is more like teachers or so who are caretakers, so they should be more like Pagan personality, so that they will be more calm, more grounded. Then likewise, people who are more like like intellectual, like expert, then they should be more like a Lung type, so that they can think fast and like. So this is actually it. It always revolves around on these 3 different types of nyapas. Okay, Metola.
And it's also great to highlight here that whilst Tibetan medicine has these 3 foundations, these 3 energies as a foundation, you can have a combination of these. So you can be a Lung Trippa and a Trippa Becken. So, and you change with age. So I don't want people to log on to this webinar and start to say, I'm only one, or I identify with a few. You actually can be more than one of these energies. Dr. Nidala, when he spoke to me, he identified me as a Trippa personality, and it's so true. I do sleep really soundly. I go to sleep almost immediately. Said I'm a lawyer by training, so I found the profession perfect for my energy. But I just wanted to highlight you can have more of one personality than other, and also a combination. And your Tibetan medicine doctor will be able to help you determine which of your energies is best for you, best suited for you.
Yeah, that's true. Yeah. So as far as the personality is concerned, so I just briefly highlighted that Lung personality, Tibetan personality, Pagan personality. So again, it could be combination of 2. Some individual may be like Lung and Tibetan type, So in that condition, then the personality is more like they have the combine of these 2. So some may so it basically says that the single Nyapa personality is 2. Then even in some cases, some individuals have a, personality of all these three nyepas. So that is considered the best personality actually, so that it will really balance, So, so this can be also, so as far as the personality, so this can also be, one can also change the personality. So there are different narratives actually. So, then like even, so we say that, so due to so many different, so this is basically the cause of any problem. So like whether somebody is having a, unhealthy or healthy is basically determined with these three energies, So when there was a imbalance or dysfunction of these three different types of personalities, then we call that as a, a problem, or, basically unhealthy state. So this is how we fix, So there are basically, again, 4 different types of conditions that energies. So they are basically diet. The first one is diet. The second one is lifestyle. Third one is again with the negative force or psychological problems. Then the fourth one is due to the seasonal change, with the, so among these 4 different types of conditions, so any given situation, so for even for for physical problem, so we said that this is because of imbalance with this energy level. Then even when we give the medicine, so the physicians, they try to know what is your, suppose if you have a diabetes, so the physician try to know what kind of diabetes, whether it's a rLung or TIBA or Pagan, So in Tibetan medicine, suppose like for diabetes, we have 20 different types of diabetes. So so among them, there are 10 types of diabetes that is to do with the Pagan, the last one. So there are, 7 to do with the TIBA, and 3 or 4 to do with the rLung. So based on, so when you encounter the Tibetan physicians, so they basically see the pulse, of your, pulse, as well as the urine analysis. Then through the interrogation, they try to figure out what kind of nyepa is more predominant, even you have the diabetes. So that's why if you visit to the Tibetan physician, so normally if Tibetan physician have a 10 patients of diabetes, so it's not necessary that all these 10 physicians will get 10 patients will get the same medication. So it may be different, So that is mainly knowing one's own kind of energy problems along with the physical problems. Then we try to fix that problem. So this is how we basically goes with that, So in addition to the vast and diverse functions of these 3 different nyepas, so these 3 systems can also occur, like innumerable imbalances and dysfunctions.
Thank you for highlighting that's actually when the Tibetan medicine doctor makes a diagnosis and a treatment plan, it's very carefully calibrated for that patient itself. That's fascinating for me to hear about the 10 different types of diabetes. So it's very personalized, very holistic, and just for that patient and their condition, their energy, and their environment, that very personalized treatment plan for the patient. Thank you for highlighting it. We're going to do a focus on the 6 qualities of rLung, because Dr. Nyima says that rLung is where quite a lot of the mental health and conditions are found. And we'd love to hear a little more about the 6 qualities of rLung.
Yeah, so so having discussed about the 3 different types of energies, so to discuss a little bit more about the, the first one, rLung. Of course, these 3 different types of nyepas are all connected with the psychological problems, but especially the rLung is more kind of it is more connected with the many of the psychological problems. So that's why to discuss a little bit about the rLung, so basically when we say rLung, or the wind and energy, so basically each of these different energies have its own specific characteristics. Suppose like the first one, the rLung or the wind energy, it has 6 different types of characteristics, so it says the rough, light, cold, types of characteristics. So suppose the first one, it's so so as far as the lung or the wind energy is concerned, it has a maximum number of roughness in terms of its like the mechanism. So this basically refers to the roughness is more refers to the mental stress, and also like a skin rough. So those who have lung problem, or the lung is imbalance or dysfunction, then one can see that especially when the lung was then imbalance, then among the patients one can see that the mental is always having a lot of stress, so that's why lung is considered as a vehicle of the mind, which we will discuss in the following slide. And also like not only in the psychological state of mind, even in the physically, one can see that the skins were very rough, because the skin, bones, colons are the locations where the lung is mostly exist. So that's why the roughness quality is there, can be visible. Likewise, the second one is talking about the mobile quality. So or light mobile quality. So mobile quality basically it means that so those who have a lung kind of so lung energy is imbalanced, then basically we can see that there was change in the personality. So somebody become easily changeable the mind, not really fixated. So one can't really concentrate on particular or one's own task. So that's why it's a very mobile in quality. And then at the same time, inability to stand firm. So this is because normally we know that the lung, wind itself is very like mobile. It the movement faculties, so that's why this is called as the mobile. Likewise, it says that it has a light quality, light. So this basically refers to because of this energy, then the mind that produce many thoughts, so those who have lung imbalance, then you have a lot of thoughts, but you can't really concentrate, you can't really make decision because of the light quality, then you have a lot of thoughts, and then your head is always in the cloud, so this is because of the light, the quality of the lung. Then another quality is cold. So normally cold, so this is also one characteristic of the lung energy. So when this cold is, basically refers to so those who have imbalance of the lung, then always feel cold, so the cold feelings that basically runs through the body, so your body is always cold, no matter the temperature, outside temperature, they're always shivering, so we can see that some individuals are very, like prone to get cold, always shivering. And also the cold is also refers to the depression. So such kind of individuals will have more kind of vulnerable to get depressed, So that's why we, especially in the winters, so many, like especially in the West, because of the winter, then people become depressed, like the winter blue problems. So this is because of the cold nature of the lung. Then talk about the subtle nature. So basically this nature is more refers to the blame, the pain, even though if you have a pain in the physical, if you have a pain, the pain that may be present anywhere in the body, it's not really at one place because of the mobile and light qualities. So the pain, it travels throughout the body, and then the recurrent thoughts, you have a lot of thoughts that recurrent, then fixation. Then the last one is heart quality. So this is basically refers to the muscle stiffness. So the lung people, they have more stiffness in the muscles, and also in terms of the psychological, they were more stubborn. So lung people, they always want to prove that they were right. So these are all because of the the characteristic of that particular energy. So this is something that we can see. Then based on that, also there are different classifications in the lung as a whole. Like there are there are countless classification, but normally we classified lung into 5 different categories. So these 3 nyabas, lung, tiba, and Pagan, it has sub-classification, 5 sub-classifications. for example, like as far as the rLung is concerned, there are 5 classifications. So the first one is called as a life supporting wind, So life supporting wind in terms of the location. So it is basically located in the head, life sustaining wind. And especially the life sustaining wind, the function of the life sustaining wind is basically the principle, this is considered the principal wind, among the so many different types of wind, especially among these 5 different types of wind. Life sustaining wind is the principal wind, from which it derives the other wind, other following wind. This life sustaining wind, it connects the body with the mind and the energy. So this is very important, mind. So this is actually the like the prime of all other energies, because these connect the physical body as well as the mind and the energy. And also the life sustaining wind, it controls the functions such as the swallowing. So we could able to swallow something. This is because of the life sustaining wind. And also the breathing is also mainly taking place by the life sustaining wind. Then the salivation, and also the sneezing and hiccups, and all these are functions because of the life sustaining wind. Then also it provides the clarity to the intellect, in the psychological level. To the sensory perception, and also it ensures the functions of the memory. So for the Tibetan physicians, normally when you visit physicians, so normally they try to see what is imbalance. If it's a rLung imbalance, then which kind of rLung is more imbalanced? Like, so for the life sustaining wind, you can understood that it has these functions. Now the second one is called as ascending wind. So ascending wind is more, in terms of location, it was located in the chest, So these different chakras, ascending wind is more located in the chest. So normally ascending wind, and the function of ascending wind is that it controls the speech, So all the speech is basically controlled by ascending wind. Then also it generates the physical and mental strength, so of ascending wind. Then it also clears the complexion. So our skin or the complexion. So we have this. So sometimes we lost the courage. Some individuals who have a lot of courage. This is also to do with, in terms of the like energy level. This is to do with ascending wind. Then likewise, it gives the ability to focus, and will also the willpower and the clear memory. This is always connected with ascending wind, which is located in the chest. Then the
we lost you on complexity, Dr. Nyima. If you could repeat what you said about the complexion.
Yeah. Then after the complexion, the ascending wind is also, it gives the courage. So we have some among the individuals, some individuals a lot of courage. Then in one part of the life we lost the courage. So sometimes we question. So I have been seeing so many patients who say that they were very bold and very courageous, but somehow after I don't know why now I become a lot of panic attack and I have no courage. So there was imbalance in ascending wind. So this gives the courage, and it also gives the ability to focus. This is also to do with ascending. So if there's imbalance in ascending wind, then you lost the ability to focus, especially the willpower and the clear memory. So this is also connected with ascending wind. Now the third one is called as an all-pervasive wind. So all-pervasive. So this wind is basically located in the chest, especially in the heart. So the very function of all-pervasive wind is that it produces the heartbeat. Since it was reside in the heart. So the heartbeat is mainly. So in terms of energy level, the heartbeat is because of the all-pervasive wind. Then also it encourages the movement of heart and the body. So we could able to, so this also the sole problem of the hypertensions are also connected with, in terms of rLung, it is more connected with all-pervasive wind. Then this all-pervasive wind is also responsible for physical movement of the walking, so this is also connected. And then it opens and closes the doors of senses and skin pores, So there was in the course of time, the sometimes even in the winter, all these pores will close, and then in summer it opens. So this is all to do with the all-pervasive wind. Then the fourth one is called as the wind that increase the metabolic heat. So this is it precise.
We lost you. We lost you, Dr. Nyima, after metabolic heat.
Yeah. So the fourth wind is called the wind that increase the metabolic heat. So this is the fourth wind. So this basically, it was reside in the stomach. So all these different types of process of digestion, So this wind, the wind that, the metabolic heat. So we call that as rLung. So this it precise over the digestion and assimilation of the food. So everything, the digestion is so much to do with this particular wind. And also it generates the body constituent, So if there is an indigestion problem or any kind of, if there is a problem in the degenerate in the body constituent, so then Tibetan medicine try to fix that particular wind, Then the last wind is called descending wind. So descending wind is basically function of this particular wind is that it regulates the retention and elimination of the reproductive fluids, especially the sperm, eggs, and also the blood, feces, and the urine. So we could able to pass these because of the descending wind. Then it also assists with the delivery during the childbirth. So we call that as a rLung, especially the constipation, one of the main in terms of the constipation. So there was an imbalance in the descending wind, and because of that, it can't really pass the feces. So it is very interesting that sometimes even like we have a particular medicine for these specific different types of lungs. So those who have chronic constipations, and then psychologically they have a lot of depression. When you depress, then you tend to have the constipation. Then it affects this particular wind called we give this medicine, it helps the constipation as well as the delivery also. Not only for the humans, even for the animals also one can fix the problems. Like in some of the Tibetan settlement in India, where when they was having the child, when the baby cows, when they were having the delivery, they used to give a medicine called CG6, that is basically targeted for balancing that particular descending wind. Then when the cow, along with the grass, when the cow consumes that medicine, it really helps for the easy delivery of the child. So this is how the it functions in a sub-classification of wind. And also wind, this is also it also classified with the age, also seasonal, and also the time. So there is an imbalance or dysfunction of the wind energy, and based on so many different other factors. So in terms of age also, so normally we say that children's, so when children's were more like so have a Pagan kind of personality, as we already discussed. So then adults, they were more in Chiba, so more fire elements. Then in terms of the old age, so when we, above, 65, 70s, then one become more like in terms of energy level, more lung. So that's more, then one can also see the symptoms that we already discussed, Then even in the seasons, like 4 seasons, there is a change in these different, energy levels. Then even for 24 hours, there is a change in these different energies. So that's why, we advise in terms of the lifestyles. So, lifestyle regimens is also, advice based on these of the, the seasonal and all these things. Yeah. Okay, now, so having discussed about these three different types of energies, so how does these energies, basically what is the cause of these energies? So according to Tibetan medicine, we say that so that's why we say that this is always connected with the principal teachings of the Buddhist philosophy. So where it says that rLung is always connected with attachment. Then so these three mental kind of emotions or are considered as the three mental poisons. So the attachment, anger, and ignorance. So from these three are the main cause of all kind of our emotions, basically. So in Buddhist psychology, there are so many different types of classification of mind. Of the classification where it says that it's a mind and mental factors. So where it says that we have so-called mind, mind is considered to be very clear, like crystal. So all the even the worst terrorist, his mind is clear, and that's why Buddhist philosophy talks about the every individual has the potential to become like a Buddha. So this is actually the one of the unique features of the Buddhist philosophy also, where it says that like it's not necessary that every individual so it's talk about the potentiality. So Buddhist teaching is not really like kind of a preaching from the top. It's more rather like doing oneself. So where Buddha said that he cannot really wipe the sins of individual. He can all this knowledge or all these different attainments, he can't really transfer in the form of blessings. He said that in the end of the day, I can be a teacher. I can show you the path to the the realizations. And then in the end of the day, you are your master. So you have to create your own destiny. So that's why like in the Buddhist philosophy, the mind is considered very clear, like crystal. So that's why it says that everybody has the potential to become like Buddha if you practice, or if you if we clean these different types of mental emotions. So basically there are 51 different types of mental factors. Among these 51 different types of mental factors, some of the mental factors are considered destructive mental factors, and some of mental factors are considered as constructive mental factors. Some mental factors are considered as a kind of neutral mental factors. So especially when you talk about the then in terms of it says that every problem is because of illusion. So we are in the constant state of like illusion. So that's why this is even many researchers also have proved that. So where in the Buddhist philosophy it says that we are what we perceive and what the reality is totally different. So this is also perceived by some of the the cardiologists, where they says that when we were in the state of anger, so whatever things that we perceive, so 70% or 80% of the things that we perceive are all illusion. So this also we also experienced that when we were so angry, then whatever you see or whatever the concept that you have on the other individual, so you think think him as 100% bad. But when we are calm, then we realize, oh, this is not. Talks about the concept of the these different niyabas. So the first one is the attachment. So we have this attachment. And because of that, the so-called the rLung energy was basically product of the attachment. Then we have this anger. So because of anger, anger. So normally when we become angry, it causes some kind of. So that's why when somebody have so much anger, then they tend to have these problems of the hypertension and all these, the physical problems. So likewise, the second tiba was basically kind of the production of the anger. Then likewise, the last one is ignorance. This is then because of ignorance, it says that pagan was kind of the product. So basically, with these mental points, so that's why this is basically the root cause of all these different types of mental problems. So it is difficult to really say that we can fix all these problems from the grassroots. So that's why the teachings of the Buddhist philosophy or teaching of all these different practices is important, so that one can really fix that from the one can clean from the very bottom. And then so
I just wanted to highlight here what you're mentioning is that the changing of the mindset. So not just treating one condition in isolation or just the condition at that point of time, but changing the patient's mindset. So when you spoke earlier about the Buddha nature, that everybody has that Buddha nature, it's actually such a positive and optimistic view of another human being, to believe that there is so much goodness, that the starting point is there must be so much goodness, and if that person is hurting me or causing me pain, it's because of ignorance. And giving them the benefit of the doubt. I've experienced it many times in my career, working with very aggressive alpha individuals, and I do give them the benefit of doubt. And I was explaining this to a colleague, and I said, by giving them a benefit of doubt, it's very freeing for me. And also it's very empowering because I have that power in myself to respond to that situation. And I'm a freer person that way. And that's helped me, that mindset, the Buddhist mindset, and that starting point, the goodness in others. I think goodness in yourself, goodness to others. And Buddha's beautiful last words were, seek your own salvation. He can't, like you said, he can't transfer the goodness or his, help you all the time, but you can work on it yourself. So I think that's what some of the Tibetan medicine doctors do, is actually working with the patient in a almost therapeutic way, changing your mindset so you are empowered in any situation, learning how to respond and using that vast Buddhist knowledge and principles to apply them in everyday life. Dr. Nyimla, we're actually already an hour in, and as fascinating as it is, I think we have to move quite quickly on. So if we could point out to some of the main points. Your knowledge is as vast as the ocean, and I feel like there's already 3 or 4 webinars in just this webinar alone, and we can definitely do another webinar on Buddhist thought if others would find that interesting. But just to highlight some of the main points in the next few slides, Dr. Nyima.
Yeah. Okay. That's all. Okay. Now. Having said that, so we will not discuss about the other nyapas. So since we are talking more, emphasizing on the lung kind of the energies. So then, as we mentioned, so when there is an imbalance or dysfunction of these nyapas, then it causes the problem in the physical level or in the mental levels, So especially when in corresponding to the lung energy. So the imbalance could be, since we already discussed about the 5 different types of the lung, the sub-classifications. So based on that, it also, have some more psychological problems. Suppose, like, for example, this is a kind of an example that if there is imbalance in the heart, so as we discussed in the before, so when there was imbalance in the heart, then it also caused some kind of problems. So in Tibetan medicine, we call basically this is named as a Nyinglung and Soklung. So basically, of course, the lung, based with these 5 different types of classification of lung, so there was a corresponding kind of implications. But somehow, based on the different, so these are the 2 actually a kind of example, especially when it's when it has some when it's imbalance in the heart, then because of that, so many different types of problem, Then based on that, we also have a specific medicine so to do with Nyinglung, we have Agar 8 and Pimala and so forth. So this is more like when we have that problem, then one can have the problem of the depressions, then hallucinations and all kind of problems, So even though this is not a mental problem, but because of the disturbance with the lung in the heart, So then it causes a problem. Suppose like especially this so-called all-pervasive wind that was located in the heart, then when especially there was imbalance in all-pervasive wind, because of that it caused the problem in the heart. Then similarly, then if there is, so then we also talk about the channels, so there was so-called as life channels where the lung energy, basically moves. So when there was imbalance with that, then corresponding to that kind of organ, then they also have some, more serious problems. For example, like, problem with the schizophrenia and all kind of mental problems, So from the Tibetan medical, Tibetan physicians perspective, so normally we try to, pinpoint which is exact, the cause of the problem. Then accordingly, we need to change the diet, we need to change the lifestyle. Then we can even give these herbal kind of, medicines to fix that one. And also we have different types of external therapies like massage, compressed therapy, like so many different, these can also be used. So in short, what we can understood is that, this lung has so much potential. So this not only in Tibetan medicine, even as we, discussed in the previous slide. So even in, when you look at the, Ayurvedic medicine in, so they always emphasize about the so there was, so that's why the yoga is basically, it comes there, so there are so many different types of yoga asanas and so many, different type level of yoga. So that is basically targeted to balance that prana, so especially these yoga masters, so they used to, when they give the instruction, they said that not only the asana as a, like body flexibility, but how you do it, and especially where you need to rest and where you need to breathe. This is more important, and also in the Tibetan Buddhism, one can see that so many meditators, so many hermits, they were staying in the, they were doing a lot of meditations. This is mainly balancing, the different, all these different, lung energies as well as the different chakras, so that this can, physically, they will become like a kind of a supernatural, power. And through that, this can also help for their, like psychological kind of the practice. So for example, like not only in the in the Tibetan meditators, even nowadays, we have the, Wim Hof, who also have done these kind of practices. Because of that, and also a lot of, for example, in the later period of time, with the Professor Richie, Davidson, so in his own lab, in University of Wisconsin, so some of Tibetan meditators like, Mingyur Rinpoche, and they have been taking, and then they, they scan their brain, where they find that, they have, they could see that there was some changes in the, even in the brain. So I think these are some of the first that it really helps in, one can also see not only in the next life, even in this very life, it have a lot of impact in our all walks of life.
And clearly you can see both the beloved Tibetan saint Milarepa hardly has any clothes on, and he's able to meditate in Tibet, and Wim Hof himself, extreme Iceman. And actually in Wim Hof, he credits that is similar to Tibetan Tumu meditation. And, all this ancient traditional healing sciences, you can completely harness your lung energy and, be exceptional human beings.
Okay, now, so this is, we already discussed, so the lung has so much connection with the mind, so this is considered as a vehicle of mind. So when there was so not only the lung, or other, like energies also, Tipa and Pagan, there was so much confusion also, like among the the practitioners also. Sometimes, people, seemingly it's become the patients they think that they have like psychotic, problems. But in the when we really look, carefully, it's because of the lung imbalance. So because of that, it affects the mind. So in some of the Buddhists, like especially in High Yoga Tantra, there is an example given to the lung horse, who can't
we lost
see.
you there. Example given to the lung.
So in some of the High Yoga Tantra, so lung and the mind have giving a very beautiful, example. Lung is considered as a horse, a blind horse who can't really see. Then a mind is considered as a man, who is riding the horse. But this man doesn't have the feet. So with the combination of this blind horse and a man that, a man who have no feet, if the man is skillful enough to control the horse, sometimes when the imbalance of the lung, then it also has some mental problems, so-called. But if the man is skillful enough to control that misbehaving horse, but if he is skillful enough, he can really control that horse, then he can go wherever we want. So likewise, so that's why in the spectrum of Buddhist philosophy or the Tibetan medicine, the mind is considered to be more important. So that's why one can see that there are so many different types of mental trainings and so many different types of teaching, encompassing on the training of mind and the different practices. So that's why so this connection is so fragile.
And that's why I think the top athletes, they work on their mind so much, their psychology, to harness their power and harness the lung. So great parallels to modern world. And, I can just imagine that this can be used for like peak performance, not just in athletes, but also executives and anyone who, wants to just operate at the best level and really harness their mind and body. And the last part of our presentation before the Q&A is 2 case studies. And Dr. Nyima, if you could briefly go through 2 case studies, please.
Yeah, so so there are so many different problems associated with the lung energy. So the first one is a patient who is 20 years old, students who have who have problem of the imbalance of the lung, mainly because of so when we in the process of integration we learned that this is because of the the pressure, examination pressures, and also because of heartbreak mainly. So for the Tibetan physician, it is important that we should really have to discuss with the with the patients and try to understand what is the cause of that vulnerability. So that is very important. So sometimes, so without not only from the the kind of symptoms. So to understand what is the trigger point, what is a vulnerable point that caused the problem. So that is more important. Otherwise, I've seen so many, especially among the tourists. So since our clinic is more, located in the tourist area, so we used to have a lot of tourists. So especially among the tourists, I find that who have a lot of psychological problems, and then they said that they came all the way to India or Nepal to fix that problem. Then they used to go to Dharma centers or like this, and then they said that their problem is fixed. But once they go back to their home, but again it comes back. So this is mainly because they were not really. They try to avoid their vulnerabilities. Actually, they don't want to be seen by others, and also for them, like personally, they don't want to touch these vulnerabilities. So from Tibetan medical perspective, we consider this is very important, that one should really have to understand what is the cause of your own problem. So what is why this problem is caused. So once you understood that, oh, these are some of the vulnerabilities that caused me the problem, then yourself, as Buddha said, you are your master. So you have a lot of resources within you, so you can apply these resources. Like even the like a small child, 3 years old child, he have a lot of potentials. Like the child he have a lot of resources. Like child, even though they don't know the world, but they said when they were in the state of danger, they said, ama or mama or mommy or something, So for him, for that individual, that small kids, to call his mother is kind of resources. So likewise, we also have a lot of resources. So that's why this is how we go with, So for example, like this patient of 20 years old, so is because of the examination pressure and heartbreak, then it causes the problem. So then that individual cannot really go ahead with the life, and it was stopped there. Everything's were so for such kind of problems, and then also which even sometimes getting worse, Then from the Tibetan medical perspective, we see the pulse, we see the urine analysis, as we discussed then we could say that which lung is imbalanced. Then accordingly, we can fix the problem. Like we have the medicine like Semde, Bimala, then so if it's the Nyinglung medicine, then we have we use the external therapies like moxa, compressed therapy, and even then through that it really helps. And more importantly, the to give hope is more important, to explain the because how the phenomena works. So this is more important. Then the second case study is about
Also, I just wanted to mention here, the fact that the patient's coming to you, they're acknowledging they have a problem and they want to fix it, isn't it? That's such a big mental and psychological step, isn't it? Wanting to fix what, wanting to get better. When I went to hypnotherapy many years ago, I actually said to the hypnotherapist, did I hypnotize myself? And he said, yes. When you come to that point that you want to seek help, that's already, a shifting something in you. So I wanted to say that, that's already a positive step, isn't it? Them bringing themselves to a Tibetan medicine doctor, wanting to get better, following your supplement advice, following, having the external therapies on themselves, but also learning how to do the therapy on crown chakra, like going through ongoing counseling. It's, it's a holistic program and it's an ongoing thing. And it's, that starts with that commitment of the individual wanting to get better.
Yeah, true, yeah. Yes. Now the second case is like, there was a one. So there are so many cases like this, but one of the Western women who was in late 50s, so she had a severe hallucination and, and also so many negative thoughts of, committing suicide for oneself, ending one's life. So this is actually the, like a big problem in today's world, actually. So for such kind of problem also, we try to, help with the medicines. And along with, like we have different types of medicine like Primala, Semde, Nyinglung. So basically, as we discussed in the previous slide, so like Tibetan physicians, they really have to understood which is the main cause of the problem, and also like then we used to give them the dietary, recommendations, like like we commonly we say don't drink the strong tea and coffee. So because we already discussed about the characteristic of the lung, where it's mobile, where it's light, so especially these caffeines, it's very light in terms of the potency, so that's why it causes problem. So in the end of the day, it is important that we should try to look from a bigger perspective. So this is actually, His Holiness Dalai Lama. One of the main messages of the His Holiness Dalai Lama is that he always emphasized about the importance of the, like where it says that everything's interdependent, so everything's interrelated. So there's nothing that, if there's one problem, it's not because of only one kind of a cause. So there are so many different causes, which when we really look at, so the concept of interdependence is very important. and also, like, so if we could able to look from a bigger scale, then the problem become minimized, especially from the Buddhist perspective, it says that, as I mentioned in the beginning, so we have a mind which is clear like crystal, and then there are 51 different types of mental factors. Some of them are positive, some are destructive. So especially in the Buddhist psychology, it says that when these different types of destructive mental factor, when it pops up, like anger, depression, anxiety, whatever it may be, or panic attack. So when these destructive mental, when it pops up, it has a fixed target to hit you, So like when we were in the state of anxiety, suppose, when the anxiety was developed, then it has a fixed target to hit you. So that's why when we look from a holistic perspective, when we look from a bigger scale, then what happens is that it lost the target, this destructive mental factor, like a panic attack. It lost then slowly it can diminish. So this is the concept of the holistic thinking. And this is also proved by the modern science that in quantum physics, they say that in subatomic level there is no independent like inherently exist kind of particles. So all these in subatomic level, all these were interconnected. So that's why everything's were interconnected. So that is very important. And in his own Dalai Lama always emphasized saying that we should really have to look from a holistic perspective. And at the same time, since we are social animal, we should have the warm heart, and also this is also very important. This is core, like concept of the Tibetan medicine also, that if you have a heart to help others, if you have that kind of willingness to help, this can in a healing process also, this can really help, So that's why Dalai Lama, his own Dalai Lama, he said that among the peoples, these bodhisattvas are the most clever people, because they are always thinking about others, they want to always help others. And then yes, when they said, for the sake of all sentient beings, may I get enlightened. So of course it takes time to get enlightened all the sentient beings, but for that very moment it really helps that individual, so that's why he even emphasized saying that if somebody cry, like if you cry with so much sadness for oneself, or on the other hand, if you cry seeing a very a miserable kind of a individual, so the state of mind is totally different. So for the sake of others, even if you cry, but deep within there is so much commitment and so much kind of
Intention and emotion.
Yeah. So likewise, the holistic thinking is very important. So with that, I think we have came to the end.
Thank you. And that's such a beautiful thought that you left us with. And clearly, you're practicing what you preach, Dr. Nyima, because you have, been so generous with your time, your expertise, and doing this all voluntarily. You're, such a busy professional Tibetan physician, but also father of a young child, and you've woken up so early in the morning to do this presentation to us. So from the bottom of my heart and from all the viewers here, we really wanted to thank you. We can clearly see how committed you are to your craft and your Tibetan medicine healing, and you're doing it with the kind intention to help as many people. We have run out of, we are overrunning, but I thought I would leave this probably about 10 minutes space for any burning question and answers. It's an amazing, unique opportunity to get some answers from the brilliant mind of Dr. Nyima Tsering La. Justin, if you could help me with any questions that have come through. I can start off with one. Dr. Nyima, if you could quickly say, have you noticed any one major trend from the patients that you've seen in Tibetan medicine, and maybe possibly a future trend that you think is happening in Tibetan medicine, just to start off the floodgates of questions that may come on?
I see so much potential for Tibetan medicine in the future, especially in today's time, where, because of the rapid development of the like the material facilities. So actually, in terms of, even though there is so much development in the modern science, but somehow people get the level of the psychological problem is getting more intense. Yeah. So it clearly proves that only the material facility cannot really subdue the mental problems. So for that, and also for all these psychological problems, I think along with the Tibetan medicine and these the teachings of the universal teaching of the Buddhist teachings. I think this is very effective. And also in terms of even not only the teachings, even the medicines also, like, so since Tibetan medicine was always talking about the function of the in these different energy levels, we emphasize upon the function of the people. That's why, like, this is and also like medicines in terms of since it is a very kind of a natural kind of a treatment, so it also have no side effect. I think there is so much potential in the Tibetan medicine in the future.
Thank you. And Justin, do you have any questions from Facebook?
Yeah, there's a couple from YouTube. Tenzin from YouTube asks, are there any particular meditation practices that help alleviate symptoms of lung imbalances? My mother and I both have lung imbalance as diagnosed by one of our local Amchi. And then the next one is, what is your opinion of supplements? And the last little question is, how does cold weather cause depression or mental issues, or how does cold affect lung in the winter?
So the third question, I would say, could I just pinpoint to a specific webinar that I did in, Justin, was it December or January? We did this in December, wasn't it? With Amchi Namgyal Kusar.
Yeah, that was about a month ago. Anyone who signed up, it's included as a bonus material in the Teachable, so that's rewatchable anytime.
Great, and that's on specifically seasonal affective disorder. So if I could just point everyone to that webinar, otherwise we're going to have another webinar, 2-hour webinar on this at this point. But Dr. Nyima, if you could give a suggestion on meditation for lung condition and supplements suggestion.
Okay, so as far as the meditation is concerned, so there are hundreds and thousands of different techniques of meditations for the lung, So, but for a very low, for a lay individual, I think breathing kind of meditation can also help, because having said that, this so-called lung energy, this is kind of it's a constant flux of movement and like things like that. Especially this especially when somebody have an imbalance of lung, that it among so in the Buddhist psychology, we talks about 6 different types of mind, so where it says that the first 5 minds are basically minds that is designated with our sense organs. So we have 5 sense organs, we have eye that we could see, nose that we can smell. But from the Tibetan psychology, it says that behind these sense organs, there's so-called a sense consciousness. There's so-called a sense mind behind these sense organs. And then the third one is called the conception mind, or sixth sense mind, or the judgmental mind, the mind that we use every now and then. So these 5 sense, even this is body sense, these
sorry, we lost you a couple times in there, Dr. Nyima. If you could mention maybe names of meditation, and then other people could Google or find books on it. So for example, Wim Hof, he says Tummo meditation, TUMMO, or if you just Wikipedia Wim Hof meditation. I think he also has some videos on the last.
There are a couple of meditations, especially these days. One of the most famous one is the mindfulness meditation, So you can, there are so many teachers who are teaching the mindfulness meditation, and also the compassionate based meditations, which is also you can find in the internet. But in the end, it is important that why this was happened, So that is more important rather than doing any kind of, like a breathing exercise. So we should know the anatomy of these problems. So in that case, I'm saying that in the Buddhist psychology, we have 6 different types of mind. So first 5 types of mind are more related to our sense organs. So then also there was a great Tibetan meditator or scholar called Charab Tuku. So he emphasized about he said that these 5 sense of minds are called as associated with so-called as body sense, Then the thinking mind we use every now and then is called a sixth sense mind. It is referred to as a conception mind. Then there is a like balance. When we have when we have good body sense, the conception mind can able to decrease. When we use too much, conception mind. So today's time, because of the education system itself, where it was training more on conceptual kind of mind. And then because of the rapid growth of the modern science also, like modern kind of, like infrastructures and the fast, today's, the lifestyle, it's also caused the conception mind. So when the conception mind increase, your body sense will decrease. So in that state, when you are using too much conceptual mind, then we lost the stability of our own kind of, the ground. Then you are more carried. And then in that state, when rLung is imbalanced, then it can easily disturb you. So that's why you should have more grounded. So for that, it is important that you can do any kind of breathing exercise, So instead of using the conceptual mind, you can focusing on the mind, focus on your breath. Then you can also do a very simple kind of meditation. You can just feel your face, feel your bodies, So this can activate so any kind of body works is also very effective.
I think people would find, guided meditation where you listen to the instruction and then you do the deep breathing. I have done, a body scan that's very relaxing in a really comfortable position, lying down, warm blanket, and just finding something on YouTube or online, which is a guided body scan. That's just for calming down.
So that's why I'm saying that it's not necessary. Instead of finding one meditation technique, so we should able to understand that it's because of the loss of our body sense, or the body's consciousness, and then because of that conception mind is getting high. So we can choose any meditation. It's not necessary that it should only one, So there are hundreds and thousands of meditation techniques, but the thing is that we should have to develop that body sense or to activate the body consciousness, so that conception mind will go down, and then we will have more grounded, and then automatically the rLung can also be balanced.
Thank you. I think, as a Tibetan, we come from that culture, we have resources and people around. I'm thinking more about, clients and patients who don't have access to Tibetans around, or knowledge, or authentic knowledge. There's so many meditation apps and anyone can just call themselves a meditator now. It's so dangerous, isn't it? Anything is out there on the internet, but actually looking for, pure and good. So another thing that came to my mind, Tonglen meditation, really concentrating on compassion. If you Google that and you find a good source, that would be really great. I'm sure Bob would have some great suggestions. Bob Thurman. Right, Justin?
Yes, I shared a link earlier to his podcast. There's some great talks with Dr. Nita, Bob Thurman, where he goes through all the foundations and all the stuff that Amchi was touching upon about materialism and the inner science and outer sciences underlying these wonderful teachings. With that, I want to thank you both for offering your time, and special thanks to everyone here in the Zoom audience. Your donations help make the simulcast available and possible. And stay tuned. We'll post information about the next one. We hope to do it again on each Medicine Buddha Day. Also look to the Menla Facebook page and Twitter account. Dr. Anita Chetinsong is leading a special Medicine Buddha Day practice tomorrow. Apparently this month there's 2 Medicine Buddha Days, and we do try to hold these talks on Medicine Buddha Days, which is an astrological day where it's more auspicious to give offerings to the Medicine Buddha and Utok and all the wonderful Buddhas that have brought these teachings to us. Were there any closing statements or anything you guys would like to close with?
Dr. Nyima Tsering, any closing remarks?
Giving this opportunity to speak about the Tibetan medicine.
Oh, we have to thank you for all this expertise. And like Justin said, the next one, I'm hoping to spotlight another great Tibetan medicine doctor on our app, Dr. Lakpala. She's a female practicing Tibetan medicine doctor, and that's why I think it would be even more meaningful, and just her own innate knowledge and real life experiences on women-specific Tibetan medical condition, and just to share, how amazing and rich Tibetan medicine is and what we're going to bring to the world. Thank you, Justin. Thank you, Dr. Nyima. Thank you, everyone, for logging in. And warmest
everybody.
Bye-bye.
The replay will be posted shortly on Teachable, but the simulcast will stay up on Facebook and on YouTube, so they can be joined at any time. And we look forward to you guys joining us again sometime online. Tashi Delek, and hope to see you next time. Let's see. If everybody wants to say goodbye on the mics before we close the meeting, I've stopped the recording. Tenzin La, I will reach out to you on email. You should get to bed. Thank you so much for staying up late. And we'll look at a better time to do this now that we've launched it and gotten all the Americans hooked on this. We'll pick a more appropriate time for our teachers. So thank you for accommodating this late hour or early hours where you guys are at.
Thank you.